What's going on, podcasting world? Welcome back to another episode of the Core Consult RX podcast, episode 95. And unfortunately, Cole can't be with us today. He had some family stuff to take care of. But in his stead, I got my buddy, Dr. Swathi, with us today. And she was on the podcast, if you guys remember, probably maybe a year and a half ago?
2 years ago.
2 years ago?
Almost, yeah.
And so she's been doing some really cool stuff in the meantime, making us all actually look like slackers. So I'm really excited to have you here, Swathi. What's going on?
Oh, thanks. Yeah, it's so great to be back in Charleston. It's been way too long.
You're living in that shabby Los Angeles now.
So shabby.
Yeah, that's awesome. I'm actually super jealous of that. It's very cool. So, last time I talked to you, you were a student kind of thinking about what the next step was. What's been going on since then?
So I think I talked to you the previous time when I was just about to start rotations, or I just started rotations. So since then, I had the opportunity to do so many incredible rotations. I ended up doing 7 out of my 9 rotations out of state. So I really got to curate my schedule and figure out what I really wanted to do. So I got to do specialty pharmacy and everything. But from there, I got to do an integrative health pharmacy rotation, and that was life-changing for me, honestly. I always was interested in nutrition, integrative health, and like looking at the patient as a whole, like holistic wellness in that way. But I didn't know any pharmacist in Charleston, in New Jersey, where I grew up, or I went to college in Minnesota, like anywhere that actually did that.
Focused on that.
I knew people who did that on the side, kind of like a passion project. So I always figured I would get a master's in nutrition or something like that. But then I saw this one pharmacist that I could find that had an API rotation in LA. And so I asked her if I could come out for a month. So I went out last February, and it was amazing for 4 weeks. I got to do a lot of teaching with her, a lot of mentoring, and all of the good stuff, like even better than, like what I do now and everything. And so I got to have that experience. And then at the end of the 4 weeks, I asked her, would you be willing to train me for a year? It's like an apprentice, or what should we call it? So we decided to start the first PGY1 Integrative Health Pharmacy Residency program. So it's the first in the nation.
So you're literally the first resident that will be going through this in the history of that program.
So I'm the first pharmacist that has like formalized, specialized training in integrative health and medical cannabis.
That is awesome.
So I've had a whole year to devote to that. And so like I spent half my time at an integrative pharmacy that's in Santa Monica. And so that's like doing everything from like patient consults to mentoring API students, because we have 1 to 4 API students from all across the planet, really. I feel like they're from all over. Like right now we have someone from Southern California, rather, like, so not LA, but outside of LA. And then we also have someone from Buffalo, New York. And so people kind of come from all over because they're really interested in learning about integrative health.
Yeah.
And then, even apart from that, so many people have been contacting me on LinkedIn, like P3s and P4s, that are saying, are you guys recruiting? Or what can I do to learn more about integrative health? So I really see a trend, and that's so exciting. So I spend half my time there, and I spend kind of the other half of the time at an integrative HIV clinic.
Okay.
So I work with all types of professionals. They actually didn't have a pharmacist there before. So I was the first pharmacist that got to join their team. So I started an MTM program. So I do like a whole comprehensive MTM with like the actual like conventional, RX medications we're used to, whether that's like HIV or, anything else they're on. But then also dietary supplements, other natural products, medical cannabis. And I also get to talk about sleep hygiene and like other things that I think are just so important, but we don't talk about them enough. Like little things that just make such an impact. So that's like a brief overview, I guess. But I guess apart from that, I do a lot of teaching too. My RPD and I taught 5 credits this past semester.
Dude, that's awesome.
Like brand new classes. So that was a lot more work than I anticipated, but it was really good though.
Did you have to like develop the curriculum and all that?
Yes.
Yeah. So I did that with the PA school. And when I first kind of like took it on, I was like, how hard could this be? Make some PowerPoint slides. I've made PowerPoint. You don't really it's so much work. And in fact, I'm in the 3rd year of teaching now. And I literally am like, I feel like I'm just as busy as I was beginning. Like I stayed up all night last night working on my slides because I had so much to catch up on all the new updates and then making cases.
Exactly.
And it's like, wow, I have a new respect for my teachers that I totally blew off before.
I know. Well, even if we tried to like create slide decks 2 or 3 weeks in advance,
stuff would change.
Things would change. We'd want to add new things, or like research would come out, or like the valsartan thing came out. So we wanted to talk about that in our statins lecture. Or everything with COVID, oh my goodness. So like things like that, like we added into the infectious disease lecture and like things like that. So it's like feels very, very relevant
That's awesome.
What we're doing, yeah.
So, okay, so for those, who aren't familiar with, the kind of the holistic approach like that, because most of us, obviously, in the PharmD world, were pharmacotherapy, the traditional, some of them weren't even that, but our generation was the all pharmacotherapy management. You're right. We definitely spent almost nothing, if any, on nutrition and food and all that stuff. I mean, because I do a lot of nutrition counseling myself because of the certified diabetes education type stuff, but I had to learn that afterwards. I was not anywhere near part of my education. So kind of go through like what that actually means for the people who aren't familiar with it. Kind of walk us through like what that looks like.
So integrative health pharmacy, how like I define it, how my RPD, and I've kind of like decided how we're going to talk about it, is just so many modalities of health that all come together and like integrate into one to help the patient. And it's really centered around patient-centered shared decision making. So it's like working with the patient is like, I guess, the main like roots of it all, but then all the like little branches and everything that come off of it are like, of course, conventional pharmacotherapy. I think a big misconception of even like students that come out for rotation think that we want to replace RX medications with supplements, which is like, oh my goodness, we cannot replace like atorvastatin 80 with a supplement.
Just give them red yeast rice, right?
So like things like that where like pharmacotherapy is so important when it's important. But then there are other patients that are like pre-diabetic and they're like, oh, what should I take? Can I take a supplement? Because my doctor told me in 6 months, if my A1C doesn't improve, then I'm going to end up on I'm going to end up on metformin or something like that. So it's been really impactful, like in that way, I would say. But it's all types of modalities. Like I've learned a lot about herbalism and acupuncture and like essential oils and that whole side. But then there's also like the diet and exercise, movement, but also rest and like sleep hygiene, like I mentioned. And then there's also homeopathy, which I've gotten like a total of 0% in all of my didactic curriculum that I can think of. So there's that side. And then other dietary supplements and a lot of MTM. Yeah, there's just so many facets of it that all I think are just so important. Like if I think about, I was talking about this earlier today, like the Council of Responsible Nutrition came out with a statistic that's like over 75% of the U.S. population is on at least one supplement. And I think that's highly underreported because that's only the people who said that they were.
Actually say they're on stuff.
So I just think it's so important that pharmacists and just other practitioners in general are able to at least like have that conversation or answer simple questions or like some version of that. Yeah.
It is kind of interesting. I mean, we have some, I guess, in like self-care type classes where we cover some of that, but it's like a tidbit.
I feel like, it's just like, oh, the cake is so important, but it's a little bit of icing on the top.
Yeah.
It's just not like, it's not enough.
And if nothing else, even just having the knowledge for drug-drug interactions. And like if you had, because that is a huge thing now. I was actually talking to my PA students a couple weeks ago about when you get a kind of a med rec with a new patient, or your nurse has a med rec, ask them about herbal supplements because they don't consider them medications a lot of times. And a lot of them obviously have drug-drug interactions and things like that we have to watch for. So it is interesting that you're supposed to be the drug expert and yet we get very little about that.
I would say it's like so half-half. Some people think like 50%, let's say, like a practitioner's thing, that all herbal supplements are just safe and it doesn't matter, so they don't need to ask. But then the other 50% are like, oh my gosh, they're going to interact with everything, so you should just get off all of them, or I'm not going to recommend any of them, or something like that. And then like overarching between the two is probably that a lot of people think there's not research out there. And that's a huge part of like our learning curve and everything with our students is, let's look at the research, let's look at the literature that's out there, and let's actually do like journal clubs with frequency. We do journal clubs probably more than other rotations just because it's so important to show that there actually is really great evidence to show a lot of these. And maybe if there isn't that like extensive evidence that we're used to, we can extrapolate from something that's been done. Yeah.
So, and that's actually one of the things I want to make sure we talked about because that is definitely the argument against some of that I see. And and I'm guilty of it some cases as well, as far as saying, well, so I even I was a guest on a podcast talking about essential oils and I was kind of ripping on some of them a little bit. But so talk us through, like, what are some of the, like, we don't have to obviously go through all of them because there's probably tons, but like, what are some misconceptions that you hear kind of very frequently?
Misconceptions. So definitely the drug interactions one is really big. And then also just, oh, it only works for my friend, it doesn't work for me, kind of a thing. Like they don't want to try it necessarily because they've heard from someone that they know or someone they work with or something that it doesn't work for them. I would say those are two really, really big ones. I think also just an overall misconception that like if it's natural, it's not going to hurt you.
Yeah.
Or if it's natural, it like we don't know anything about it because it's this like mysterious herb or something like that. And there is just so much research that I think people are, I don't know, maybe people are just like not sure how to evaluate it or something like that, because it's not something that we're really taught to evaluate in the curriculum. So maybe that's something that's like a room for improvement.
I think we have a hard, like there's a lot of times where people don't know how to evaluate any kind of literature, let alone something that's not, pushed, in the popularity area. So, yeah, I mean, you talk about, stats, you could spend an entire 4 years of college on that.
Oh, yeah.
And so, yeah, I think that's a huge thing. I mean, there's lots of healthcare professionals that have no clue how to do that. So one of the ones, and this is just a random thought I had, so I just want to get your thoughts on it while you're here. So one of the things that always pops in my mind is because statins are so prevalent, especially in primary care where I typically work, there's always the argument of whether to use CoQ10 or not. I completely understand from a theoretical standpoint of like where that getting that idea from and how we're replacing the ubiquitin and all that and complex and 1 through 4, all that cool stuff. However, the argument like the American Heart Association stuff says is that there's not any good evidence, so they recommend against it. I've always kind of looked at it if like the patient thinks it helps. Cool, but is there some new evidence out there that shows that it actually is like from like a placebo-controlled situation that it does work, or have you seen anything about that at all? I just know it's one that people I get asked about all the time.
Oh,
so
I get asked about that all the time
Cool.
too in the pharmacy. I mean, I don't know about placebo-controlled to be 100% honest. However, though, there are patients who come in that have read XYZ thing about it, or they've chatted with whomever, and they think that they want to try it. And in that case, it's like a risk-benefit kind of ratio. And most of the time, the benefit just outweighs the risk. So if they're super keen and they really want to try it, I don't think there's a harm in trying it.
Yeah.
For certain people that are looking for like a certain added benefit, like antioxidant effect kind of a thing, is a lot of people associate with CoQ10. So if they're looking for other therapeutic benefits or like impacts, then sure. But I mean, I see the benefit, but I also don't think it's like super imperative that everyone is on it who's on a statin. I
heard somebody that was talking about like functional medicine and stuff like that, and she was saying that literally every single person that's on a statin has got to be on CoQ10. I was like, okay, that seems like a bit of a leap too, because I also don't think everybody has cardiovascular disease has to be on a statin. So like there's always an exception. You can't say everyone.
That's another thing with my RPD and I were talking about nutrient depletions. That's another thing is like a lot of people who say that they're on metformin, that they should be on a B12 supplement. And yes, that is over time, but like just because you start metformin yesterday does not mean you start
your B12
like,
tanks.
Yeah, exactly. So that's another like misconception to answer your other question.
Is there too much B12 that you can take?
Oh, not that I know of.
Okay, good. I'm just kidding because my levels are probably through the roof because I drink these things all day. So I was just wondering that since I got you. I got an expert here. I'm like, let me make sure because I tell my patients it's okay to try it. But yeah, I agree with that. Like, it's something that I'm kind of actively looking for because a lot of my patients are elderly, been on metformin for years. So they start having like signs of neuropathy and things like that. I'll usually I don't even test them for it. I just say, hey, take this B12 supplement, and if it works, great, and if not, then we'll go to the gabapentin or Lyrica or something. But
exactly.
yeah, it is. I don't think anything in medicine should be everybody. Like
I 100% agree. There's too many variations between people, which is like another like nerdy interest of mine, which is like pharmacogenomics. And I just think there's so many genomic impacts with like medications, the actual person themselves, the way that they like metabolize food. Like there's so many different ways that genomics play a role that we just don't know yet.
Something I was thinking about the other day too, I was talking with our dietitian at work. We just hired a new one, and we were talking about actually like taste and how that there's just such a genetic, and it's something so simple, but I never really thought about. Like, why does broccoli taste delicious to some people and other people just hate it? And yet we tell every single person, you have to eat it, it's good for you. It's like some people, they literally feel like they're tasting like soap. And I thought that was interesting. Like there's a genetic component, even as something to that. So yeah, I'm very interested in the pharmacogenomic stuff as well. I think that's going to be revolutionary.
It's going to be huge soon, I think, especially when it comes to like personalized medicine and really individualizing treatment like that for patients. I mean, and even like with certain, like we can even take that to like SSRIs and everything
to see if they're even going to work.
Exactly.
I
wish that was more mainstay.
Oh, absolutely. I think now that the cost is starting to come down, that more people are going to afford. I just think it's going to take people talking about. I think it's just like a whole nother area of medicine that people are like, I want to learn more stuff.
Or it's just like so much extra time or extra effort or that kind of a thing, or is insurance going to cover it and all of that good. Yeah.
Kind of like washing our hands was back in the 1700s, and we didn't think that was necessary.
Yep.
I think it's going to be interesting to see if this plays out, but I'm pretty convinced that there's going to be a time like maybe 20 years from now we'll, our generation will be sitting around going, do you guys remember we used to use journals that used to use statistics and lumped everybody together and we just extrapolated that instead of just individualizing everything? That's going to be like a joke 20 years down the road for sure. I'm putting that on the record now. But, okay, so you just mentioned the other big buzzword right now, which I'm super glad you're bringing up because I've wanted to talk about this forever, but I want to make sure we have an expert, not somebody like me who just read a couple things about it. Medical cannabis. That is like a very hot subject right now. So how did you kind of get into that aspect of it?
So that kind of started very organically, I guess like wordplay intended. So my RPD and I had an interest in it. We knew that it was like very pharmacologically interesting, but we didn't know much about it to start. We just started like learning more and more and networking with a lot of really great people on LinkedIn who are like the prime dogs, in my opinion, that are in that entire space. So we just had an opportunity to really learn from a lot of them and a lot of resources that they recommended. And then it kind of just spawned from there. So initially we started the residency wanting to focus on nutrition, pharmacogenomics, and medical cannabis. And then, of course, just smattering of like leadership and entrepreneurship, because that's our interest. But
just a couple more subjects to cover. This is like the most elaborate residency I've ever heard about. It's awesome.
We had a lot of ideas started.
You just went with all of them. I love it. It sounds like the best residency of all time.
We ended up starting and like ending with pretty much everything that we really, really wanted to do, which is exciting.
I love it. I absolutely love it. That's awesome.
And so with the medical cannabis part, we thought it would be a third or a quarter or something of the rotation or of the span of the year. But the way it's all played out, really interestingly, is like the demand for how much people want to learn about medical cannabis. And by people, I mean like practitioners, patients, caregivers, like you name it. And they all want to learn about it. And they all like don't really know where to turn. So like being able to be that person, like the educational, I guess, like face of that has been a really great experience. And like through people asking questions, I've got to learn more. So I feel like over time I've like grown my knowledge base, and it's like if you're interested in like pharmacology at all, it's so amazing to nerd out on. Just because the cannabis plant has so many facets of it. We could talk about constituents, we could talk about drug interactions, we could talk about terpenes, like there are just so many things.
So drug interactions, like that's the big one is, is there drug interactions is one of the big questions I've always heard. So what is some of the things that you kind of pop in your head, like right off the bat with that?
Yeah, so CBD is metabolized primarily by 3A4, but also, golly, I get it confused. I think it's 2C19, yes. So CBD and 2C19 are the two that were like that primarily metabolize CBD. But then if we're looking at THC, it's primarily metabolized by 3A4 and 2C9, but also a few other CYP enzymes as well. So I guess if we're looking at those specific enzymes, we want to look at the other drugs that impact or are metabolized by those enzymes. So that's something to be aware of. However, a lot of the clinical trials and everything that have been done, the doses are like 200 and 300 milligrams, which the average person who's taking CBD or THC, even like for therapeutic benefit, are not taking that much. Unless
you want to talk to dolphins, you don't need 300 milligrams.
Exactly. Yeah.
That's interesting.
And so a lot of the research is based on that. So, I mean, and they did find like, yes, there were certain medications you shouldn't take that are, metabolized or impacted by those CYPs. So I go back and forth on it. If someone comes in taking warfarin, then I'm not super passionate about like recommending marijuana or like CBD in particular. But apart from that, I think that more research needs to come out, but I do think it's something that practitioners should know.
Absolutely.
That's how it's metabolized. It's not just like going through some like random channels that we don't know about or something like that.
The studies that have been done looking at drug interactions, is it the cannabis studies that are doing that, is it smoking or consuming like edibles, or what are they normally looking at, both?
As far as I know there's quite a few about smoking. I'm not sure about the ingestibles or not.
Because that's metabolized in a different route, right? Because that would be more on the liver side originally with first pass metabolism. So don't you get some different, more psychoactive like metabolites in those cases?
Potentially, it's just, psychoactive is also a super interesting term.
Yeah,
too,
and I'm using, again, buzzwords because I'm stupid, but you know what I mean. Because I'm by no means saying that, I'm definitely not someone that's against the idea of it. So as far as, you get a slightly different effect potentially from eating it versus, I guess, smoking.
And like how much you end up metabolizing from it. Because ingesting it, you really don't get that much out of that just because of the way it goes through your entire GI and everything. So it's just very different. And then topically, people worry about drug interactions, but I mean, it's topical.
Yeah, it's topical.
It's not systemic absorption. Yeah, so it's like different things like that too. So when people ask about drug interactions, it's so like multifaceted. And then also like what ratio are they ingesting or what ratio are they consuming? Because I mean, if it's like a 4-to-1 of CBD to THC, maybe we're not as worried as like a 1-to-1 or something like that.
So, where you're living, obviously, recreational use is legal and everything. So, are people even using CBD oil out in California? That's still
so much.
Why? What's the thought process there?
I honestly think it's a media buzz.
Gotcha. So they just think that one's a drug, one's medicine.
Versus
both.
And so much of the marketing is like CBD is just like a dietary supplement, which I think can be dangerous depending on what medications they're on, the other like disease states that they're diagnosed with and all of that. Of course, it's individualized, as we said, but I mean, it very much depends. I just think a lot of people think that CBD is completely harmless.
I've always assumed that because CBD is huge here in South Carolina because we don't have legal or medical use marijuana here. And so I've always just assumed that the second it gets legalized, CBD businesses are just shutting down, going out of business, but apparently not.
I don't know if they'll go out of business. I just think they'll have a lot more competition with other companies that are not just only doing CBD. Yeah. I know there are even other companies that are doing CBD with like other botanicals, which is just so interesting because all the cannabimimetics and everything. So other, botanicals or other substances or foods that are other foods that like work right on the like CB1 or CB2 receptors. So that kind of a thing too that can impact the endocannabinoid system besides the cannabinoids that we're used to talking about.
Yeah. That's awesome. And we were talking before we started recording, one of the things that I'm just glad about, because regardless of where you stand, whether it's, personally or politically, whatever you want to call it, like on, cannabis use, like the big thing that I'm excited about is the fact that we can research it now. Like we have all these other like Schedule II controlled substances that are no problem. I mean, you're just regulated, but no problem to study versus something like cannabis. You can't even, you have to go through all these hoops to study. It's like, if nothing else, can we at least give it to the scientists and let them do what they do? And because there's absolutely been proven that there's medical benefit to it. So why would we not want to study that? And now they're starting to find like you're using the like mushrooms with PTSD patients and all some of that, like that it's like we're just now doing this. Like how long have we known about these and we're just now using them in psych treatments?
Well, and there are other countries that are so far ahead of us. Like Canada has been doing psilocybin research for like forever. Israel is like the prime location if you're looking for like cannabis research and everything. So other countries have been ahead of that. But I mean, overall, I'm like really hoping for the decriminalization of exactly what you just mentioned. So the psilocybin and marijuana overall, just because there's so much therapeutic potential we just don't know about.
And I mean, in other countries, Europe and I think Sweden and stuff, they use even like DMT clinics and things like that. I mean, they've published like good results. I mean, compared to what, we have limited options. I mean, like, why would we not, especially under medical supervision? I get like you don't want your kids running around doing DMT and, or, doing toad medicine or something. But like, the under scientific watch and medical, like to me, like why would we not explore every option?
Exactly. I mean, particularly if something is like more cost effective or more easy to access. Like there's so many other like facets of just looking at one substance. Like once it actually hits the market, there's so many other things. So if there was some way we could also like decrease cost with that too.
What's the other one I was hearing about?
MDMA.
MDMA, and then there's also Ibogaine for like opioid withdrawal and like trying to get them off of that. I've heard Ibogaine clinics that have had some success. I mean, obviously that there's other issues and stuff like that, but like even microdosing and things like that. There's just so much. It's like a whole. I've started reading up on some of the just the organic chemistry behind it. I'm like, it's becoming very fascinating because there's this whole world of science that I feel like has never even been remotely talked about.
And microdosing, even with cannabis too, is like a huge new area. So
I think one of the things that and for me, I love science. So for me, I'm not saying that I want to research this stuff just so I can do DMT all day long. But from a truly scientific, we can study fluoxetine too. It doesn't mean I take it.
Exactly.
And that's the thing that I want. Like, I want to see how it affects the brain and like what's going on. I mean, we see these crazy radical, especially with something like DMT, where you're getting these crazy, psychoactive event, and like, what's going on there? How's that working? I think that stuff's awesome. Like,
it really is. And just like, I mean, if we're going back to cannabis too, just the way that...
sorry, I'm way off topic.
No, that's fine. No, that's fine. Just the way that like so many other systems and elements and so many other things can impact the endocannabinoid system is just so important. Like, it's so tied to so many other organ systems. So if we can enhance our endocannabinoid tone, is technically what it's called, then we can enhance so many other of our organ systems. So I just think it's like just underlying to so many things. If we think of like an umbrella, and then all the like little rain droplets are all like the other, organ systems. But I really feel like the ECS is just like so tied to so many of them.
Yeah, that's cool. That's a good analogy. I like that. Yeah, and I, like you said, I just don't think in the PharmD curriculum or really any other MD curriculum, we just never even mentioned. It's like, yeah, that's common, medical cannabis. If they have epilepsy, we'll talk about it later. And it's like...
or like one slide on epidemics.
Yeah, right, exactly. And it's like, I feel like that's going to be... I feel like our generation of healthcare doesn't have the same stigma around it. So we're at least going to like let science kind of run its course on it.
And then slowly but surely, there are like certain MD programs, certain PharmD programs that are integrating, whether it's the endocannabinoid system into a few lectures, or they're like starting their own elective courses.
Yeah.
So UCSD is starting their own elective course, which is so exciting. And
it's
so
a full course by itself?
A full elective course
That's
on
awesome.
like medicinal cannabis and pharmacology, I believe it's called. And so my RPD and I were asked to be a guest lecturer. So we'll be guest lecturing in like late May.
So you guys are like rock stars. That's awesome. I love it. I mean, because you kind of like came up with this idea, and then like, because I mean, I've heard you in, when we had Beiju with us and stuff and talking about it, but like to see it actually happen, you'd be like the first one to get a residency. That's awesome, man. I'm so pumped for you.
Oh, thanks. Yeah, I'm having a really good time. I feel lucky.
That's awesome. So, as far as like kind of that development, how did you go about getting like the residency like accredited? Can you talk us through that a little bit? Because I'm actually fascinated on that part of it myself.
So the residency is not accredited.
Gotcha. Okay.
And so like we looked through the accreditation, all the paperwork and all like the requirements, and a lot of the things and a lot of goals we had didn't really necessarily align with exactly the specific requirements, like hourly requirements and all of those things. But I mean, we were very interested in research, so I'm supposed to be showing a research poster at the Cannabis Science, conference, but that just
Thanks
got
a lot,
postponed.
Corona.
Literally today I got the email. It just got postponed, so it's so disappointing.
That sucks. I'm sorry.
So, I mean, but like apart from like that kind of stuff, I mean... We really looked into it, and maybe that's something for the future if we end up like partnering with a university or something like that, because there's so much benefit from partnering with a university with like, of course, the name and of course the funding, but also like all the other contacts and people who know so much about what we're trying to do from like a periphery standpoint. So that would be really, really great. I'm hoping for the future that that's something for the residency.
I almost think like, and this is more because I just, again, like to go back 2 years from now and see if I was ever right or, when we were talking, but I almost think that like, I like that you guys are kind of going against the grain and not, because anytime I feel like there's some governing body that gives you this set way of doing things, especially with you guys are revolutionizing like a space, how are you supposed to take that and you have to end up twisting it to fit the structure versus you adapting it to do what you want it to do and letting the structure fit you. So I almost think that's cool. And, I didn't do the traditional route either. And so, I was told I was never going to be an MCare pharmacist kind of thing. And, and then after I got board certified in BCPS and all that stuff like that, and people are like, oh, what, how did you do that without and I'm like, because there is more than one path. You don't have to follow the exact.
And I mean, if someone told me I was going to do residency in,
I remember. You were
school,
like,
I'd be
no
like,
shot.
No, not a chance. Because I always thought of residency as like something in the hospital or something in the community setting. And I guess I have like a variation of both of those. But it's just so completely different because it's just specialized in something I'm actually like super interested in.
Which makes those long hours so much better.
Oh, yeah. And like 6 or 7 day weeks are fine.
Yeah. Because you're doing what you love.
Exactly.
Same kind of thing with like this. Like I like, people have asked me like, oh, you're going to burn out from, I'm like, no, because even if I'm tired, I'm tired from work today, but I'm also really looking forward to jump on the podcast because this doesn't seem like that, even though it's all medical based, it's not like I'm at work and like, at my desk.
Yeah.
So that's cool. I think, I'm glad that we're talking about this too, because I feel like there's a lot of students, and I've been getting a lot of questions about this too. I don't know. I'm sure you get hit up like crazy. The amount of students that always kind of come up and because they've been told there's this one way, and if you don't do it this way, you're never going to amount to anything. And so they're like, well, wait a minute, how did you kind of start all this stuff and you didn't do that path? Like, more people need to talk about it.
And I'm actually talking at MUSC. So that's my alma mater for those who don't know. So I'll be talking. I'll be talking at MUSC on Monday evening.
What time?
At 5 p.m.
Okay.
For students.
We're
I'm hoping a lot of students will come.
Yeah.
It's in BEB, so BEB went on. And so I'm
gonna try to get out and come watch that then.
So I'm really excited, and it's pretty much like about my path, but then also like tips and tricks, and then networking and like everything that's gotten me to where I am now, and like feel like I'm finally at the point where I can like give advice.
Yeah, that's awesome. And that's we actually touched on this, I feel like, last time you were here. But we were kind of talking because I think you and I both share the philosophy of like conferences and stuff. They're great. They have their place, but as far as that's the sole place you need to go to network is insanity in this day and age.
That's just way too much pressure you're putting on yourself for a 3-day conference.
Right.
That's way
and what if you're like an introvert? Like, it's one thing if you can just like jump out. Like, I can usually talk to people pretty easily, but like there's lots of people who don't feel like that. So now they have all this pressure to try to like act like this
60
fake
people I want to meet in 3 days. It's just not plausible. So there has to be other like routes for that.
Yeah. I gave a talk at USC in Columbia, and it was at the Kennedy Center, and they were basically I kind of hesitantly like was basically telling them, look, I'm proud of you guys for coming to this conference on a Saturday. Like, think it's awesome you're interested in this, but realistically, every single person in this chair, my phone number is on Instagram. Like, you could have just texted me today, and I would have answered your question personally. Like, it's just a different world, and I feel like we're still teaching the same way. And not that that's wrong. It still has its place. Just like journal articles have their. I mean, like hard copy journals have their place. But I mean, it's just like. It's just the fact that we don't even mention the other stuff, and a lot of times in academia, it's like... And
it's like so many things that, like, we don't need to replace other part of the curriculum. We just need to add a little bit.
Yeah.
Or, like, even if it's like like a monthly lecture, or like something like that from someone who comes from a more unconventional space, who's doing something they're excited about, but they're also making, like, some sort of impact on whatever population they're trying to serve. So, like, something like that even. So not really, like, even adding any credits or, like, making it too complicated.
And that, I mean, honestly, that's kind of what I like about, like, this format. Because, like, we're talking over 30 minutes already. And, you're not going to get credit for this. But, like, we can, we don't have to check with anybody. We don't have to meet with anybody to get permission to talk about. Like, and it's free. Like, I actually met with a student from USC yesterday about starting her podcast.
Oh, great.
And I'm like, she's a P1, so she goes, I don't know if I want to. I'm like, do it. Like, what? Like, are you kidding me? Like, this is
Imposter
time.
syndrome is so real. Though.
Yeah, like
it's so real.
And people are so worried about, like, well, what if I don't look like I know? Then admit that you don't. You know how many times I tell people on this podcast how stupid I am? Like, I'm like, if you don't know something, admit it. Like, you don't have to fake it till you make it.
It just makes you seem so much more like relatable and human, because everyone feels that way at some point. Yeah. I've definitely learned that the hard way, I think.
So, are you guys doing anything like as far as taking what you've learned and kind of putting it out there? Like, what kind of like resources do you guys have available for other people to kind of learn and stuff?
So actually, it's funny you asked that. So, my RPD and I want to continue working together after this year. So, of course, the residency is only a year. I end in June, sad, but and then after that, we still want to continue work together. And I'm going to be in the LA area after. And so we decided that we're going to start like an LLC on the side. We've already like started doing a lot of the paperwork. We have the name. It's called Farm Supplement. I'm super excited about it. And so we really just want to put together a lot of online courses and materials and resources for people to just have at their disposal, mainly practitioners and students as well, just because we get so many questions from practitioners, whether that's like pharmacists, MDs, nurses, PAs, but also patients. And so if there was some way we like started pooling all the questions and realizing that we should just create online courses so that people can just access those and have access to them as long as they want, as long as they, they pay some, nominal fee. And just be there as that resource. And of course, like, I'm really interested in drug information, so I'd love to do also like on-demand drug information. So if people had any questions, I could like look things up for them.
Partner with Amazon, be on the Alexa whenever somebody asks for you.
That would be awesome.
Right?
I would love that. So like something like that, but also that'll be like on the side, but it's mainly like creating opportunities for people to learn about things that like students are constantly asking me about, finding me on LinkedIn and asking me. And then also other like practitioners, there are other like PGY1 residents have reached out to me, but then also other practitioners that are 3 or 4 years out that are like, I'm in this job, I'm not super excited about it, but I think nutrition is really important, and like, how are you doing what you're doing? And so that can be answered in like an online course and potentially drug information questions. And I like making infographics too. So I've been like putting out some of those on LinkedIn too. So it's like a combination of any like way of educating people.
Yeah.
Yeah.
Is LinkedIn your primary like social media? You do stuff on Instagram or Facebook or any of those other ones?
Facebook, not really.
Yeah, I mean, Facebook for me, I feel like the only people that follow my Facebook, I leave it on there for like my 40 to 70-year-old population. I just leave my stuff on there, and usually it's just because I repost it from Instagram.
Sure, yeah.
But LinkedIn is really exploding.
Oh, LinkedIn's my number one, but then I do see the benefit of being on Instagram. There are certain, like demographics that are very much still into that. So I try to like rephrase or something that I put on LinkedIn for Instagram, but LinkedIn is my primary go-to. I just think networking on there is just so important.
So easy.
And that's like a big part of what I'm talking about on Monday too.
Yeah.
Is just, you never know who you're going to meet. You never know who you're going to interact with. You don't know who they know, which is so important. And so just literally sending out a message saying, hey, what you're doing seems super interesting. Do you want to chat? People either don't respond, totally fine, or they say, oh my gosh, yes, let's talk, because people love talking about themselves.
Right. That's a good point.
Yeah, so it's like,
tell me about yourself. And then be like, I don't mind if I do.
Let me tell you my whole career.
Yeah. So I'm awesome.
So it's literally one or the other.
Yeah.
So if they don't respond, okay, fine. But if they do, you're going to get some like incredible talk. And even if it's like one little bit that you can write down in your journal, like I started keeping like a networking journal kind of a thing. And keeping like one line, even from a half an hour call, is a benefit. And you never know, if you connect with them on LinkedIn, the other suggestions that you'll get on LinkedIn.
Yeah,
which is
true.
huge.
Yeah, they have a lot of organic reach now because
really
they're trying to like
their algorithms are on point.
Yeah, for sure.
Yeah.
Good job, LinkedIn. Because there was a while there that they were kind of like, and I remember telling even like Beju, I was like, I don't really mess with LinkedIn that much.
Yeah.
But now I get between 10 and 20 like requests to whatever they call it, link up, whatever, a day. And I'm like, what is going on? Like, it's explained. I'm actually trying to now look and see how I can use it more, because I was so, kind of on the back burner with LinkedIn.
Yeah.
And Instagram is really my main one that I have all my followers on, but I'm like, oh, what am I doing? I need to find a different way to contextualize my content and make it more the professional, version of it on LinkedIn and push it that way. As far as like reaching out to people on LinkedIn, one thing that I've always encouraged students to do is to like not just copy paste. Like give them context to that person so they know that you're not a robot.
Right.
Or like definitely don't use the thing that gives you the different font of the name and like all that robot nonsense. Do you agree with that? Like, you think it should be something they should really like spend the 5 to 10 minutes and write them an actual?
Oh yeah, I think that I think the skeleton can be the same. Like, hi, my name is blah, and I'm a student at wherever, and then end it with like best regards kind of a thing. But I think in between you should say something more specific about like, hey, I looked into your company and I'm interested in XYZ that like pertain to the company. There should be something that kind of signals that like you actually looked into what they're interested in, so that gives them a reason to actually want to talk to you. Because I mean, probably the people you're messaging are very busy, important people.
Right.
And so they have to have like a reason to go out of their way to really talk to you. But I think that overall it's like the same skeleton, but maybe you change 2 sentences or something like that. Yeah.
Because I know I can always tell the ones that literally have copied, like, and it's usually the financial aid people, like the ones that want to manage my money for me. Yeah. So I get them and they're like, hey man, and it's like they're my best friend, and I can tell it's like the same spiel they give everybody. I'm like, dude, you don't know anything about what I do.
Give me your email here and I'll send you all this information.
Let's chat on the phone. Totally. Let me give you my money. That sounds like a good use of my time. Versus like the one, like, and I can always tell the difference between those and like the students who are reaching out to me, because it's like they're like, oh wait, follow your podcast, and like it's like, I'm like, oh, this is a real person. So yeah, that makes a huge difference to me of whether I'm going to spend my time writing that person back. So yeah, I think that's cool too. And then what kind of stuff do you when you were kind of building your LinkedIn profile? We're going way off topic, but that's fine. Like when you're building your LinkedIn, what kind of stuff did you start kind of putting on there? Like, what did you look to kind of build that presence on there?
I I think not being afraid to post on LinkedIn. I always thought like, oh my gosh, the people I'm connected with are so incredible for so many reasons.
That's a good point.
Just not feeling comfortable initially with just posting like what I was doing. Like I went and saw Gary Vee and I was like, should I post about this? I don't know. And then I decided to
so jealous right now.
Go for it.
Can't even imagine that you get to hang out with him, watch him.
Oh, I wish I hung out with him. But yeah, no, I got to see him. And so I was like, do I post something? Do I not? And so that was kind of like the start of it. And of course he's a great inspiration for that too.
Yeah.
And then from there, it was just going through and being like, what am I doing that's like could be important or interesting or something to someone else? And I think we also get really caught up in our minds and we forget that some things that we do on the daily are actually something that's like going to be really impactful or even just interesting to someone else. So that I've had to like really stand back and think about that my RPD is amazing about this stuff. Like think about like how other people would look at you from the outside. And then that's helped me like put things out and like post a little more frequently and everything. And for me, a lot of it has come from like content creation, actually. I really like to write. So I write for online publications. I also write like my own articles too and post them on LinkedIn. And that's really helped with traction. And I think also with people like taking me, I guess, like a little more seriously and giving me a little more confidence that I'm putting out like articles that I'm reading, whether that's like analyzing primary literature, like market trends, which is like a nerdy interest of mine. So like
you
if
have
I'm
a lot of awesome interests, by the way. It's like every time I thought I was doing a lot, and now I'm talking to you, I'm like, I need to step up my game.
Maybe I have too many interests,
big time. No, it's awesome. I love it.
So like just writing about certain things like that and then posting them. And then like I recently did an article on CBD and consumer preference. And I was working with a company who gave me like really, really cool, like confidential data that they had gone through and like tabulated, and they wanted me to analyze it with other, sources. And so I wrote that. And then from that, I've gotten so much response of people just saying, oh, this is very interesting. Like, can we talk further about it? Or can we talk about what you're doing? Or just like practitioners that are interested. So I would say don't be afraid to like create content, but also don't be afraid to just like post something. Like you attended this conference. Here's a photo of me with my poster. Like you should do that.
Like I'll quote Gary Vee since we brought him up, but like the whole document over creating. If you get stuck in that whole, what do I actually make? Document your like process of I'm a P1. I have no clue what I'm doing. I'm drowning right now in school. Because 3 years from now, you're going to be talking to another P1 who you've already made it through, and now they're going through that, and then they can watch your stuff. And
I mean, initially I heard Gary, I was like, that sounds scary. I don't know about this.
Yeah.
You just kind of have to bite the bullet and go for it. And then it's fun. You just have to go through like that first 1 or 2 posts where you're like, oh, I don't know what I'm doing.
You're like, oh no. and also like you said, like not caring about the whole, because I still get, I had somebody just crap all over my podcast not like too long ago, and they were like, this is the worst thing ever. You're like, you must be such a moron.
Thank you for your opinion.
I was like, man, why are you so angry? like why did you just have a really bad day? I'm sorry, like geez. But like that's the kind of stuff that I think really people are worried about, and then in reality it's like the amount of good that you'll get from that versus the couple people that are just having a bad life, it's just crazy.
Yeah.
It literally took me, I was actually just talking to a student about this yesterday, it took me probably 2 months to make my first, like, which was the worst quality video you've ever seen in your life. I did it on GLP-1s for diabetes, and I was like analyzing some of the data and stuff like that, and it's maybe a 7-minute video, 10-minute video. It took me 2 months to make that stupid thing because I just kept editing everything. I'd say and be like, oh no, blah, blah, blah. And then it just finally dawned on me. I'm like, well, I do say I know I'm not supposed to, but if I go to
humans say so
right, and if I go to a conference and all of a sudden I start talking, they're like, who is this idiot compared to the guy we hear in the podcast? That's why me and Cole decided not to edit anything.
Yeah,
because I'm like, here's what you get. If you don't like it, I'm sorry. Thanks for giving it a shot. But it's like I didn't want it to be like this fake, New England Journal of Medicine style where you just kind of read off the slide. I can tell the guy's sitting there reading, and it's like, dude, I don't want to listen to that. So yeah, I like. So do you post like pretty much every day on LinkedIn, like some kind of?
No, I do not post that often. I post like when I'm recently on a podcast, I'll share it for my network, or if I recently write an article that's been published in some location, then I'll post it. Or like I just presented today at the conference, so I'll probably post something about that. So only if like I think things like there are certain people on LinkedIn who post too much, in my opinion. And so I don't want to be to the point where people are just seeing my name and they keep scrolling, because I find myself doing that.
Yeah.
So I want to post, I try to shoot for like every week or like something every 10 days, like something that I think that I want to share.
And
I think there's
that
value
makes
in
sense.
sharing.
Yeah. And especially if you're writing a whole article, that's not something you're going to do every day.
Yeah, exactly.
So that makes sense. That's cool. You guys do have, for your website and stuff, your website looks awesome, by the way. I clicked on it earlier. But you guys do use, like, have an Instagram page and stuff for that as well, right?
For Farm Supplement or for my personal website?
You know, you're for Farm Supplement.
For Farm Supplement, we do have a website and everything, yes. But we don't have, like, a super active Instagram at this moment, no.
It's all good. Start somewhere. That's cool, though. And I'll get, like, a copy of like all that stuff and I'll put it in the show notes so people who are looking for it, we can make sure we put it out there.
Yeah, we're trying to like really build out our newsletter right now so that we can start sending out more resources via email and then like update people with online courses. So that's kind of our like current game plan, but I think we're really going to ramp everything up once residency is done just because there's a lot going on. So once that's done, then I think we'll really start like on the whole game path for that.
So are you thinking like down the road, like maybe making your own like board certification for like this kind of path that you're on?
I have a lot of mixed feelings about that because for a while I really, really thought that was my route. But now I kind of think that it's important that everyone should know about natural medicines to some capacity and integrate that into their like scope of practice, so to speak, and be comfortable with integrating it. And so I don't want it to seem like this
specialty,
overbearing thing where you have to get a certification. I would love it if people just had access to that information.
No, that's cool. That's awesome.
So that like mentality has definitely evolved over time.
No, that's very cool. It makes sense. So as far as like the residency itself, once you're done, like what's next? Like who's coming on board? Have you guys had anybody match? That match day's tomorrow, isn't it?
So it's not technically match because match is what the accredited
duh.
But we have had so much interest. It's just my RPD is a new grandma, and so she's kind of focusing on that a little bit for this year. But we're in the process of talking to some programs and some schools and things to collaborate. So we're not recruiting. We're not going to start anyone in like July. Say we, like I'm a part of it. But my RPD is not going to start with anyone in July. But then after that, she wants to start recruiting again.
Are you gonna? Is she plan on doing like just one person at a time, or is she gonna do multiple?
I mean, I think she would love to have more than one at a time.
That'd be cool.
Yeah, I think for now one is great, just because we have such an active API program. That like right now we have 2 students, but like, I mean, a few months ago we had like 3 students. We actually, that's a lie. We have 2 students now, but we also have 2 students that are doing what's called an advanced elective. And so they're doing a clinical research project with an IRB and everything. And they chose our site to do a project, like a survey. And so we're helping lead up their projects. We actually have 4 students plus me. So it's quite a lot of people.
Yeah, that's a lot.
So I think she would love to have more than one resident, but just like feasibility with location, perhaps it's not an option unless she starts taking less API students.
I got you.
Which I don't think she wants to do.
Yeah.
She loves having API students.
The API students is definitely cool. So as far as like, are you going to be involved with the residency program going forward? Are you going to be working on your own projects on the side? What do you want to do?
So I would love to be a part of the residency. I've like voiced that to my RPD, so I hope I'm a part of it. Even if that's just like with recruiting, I just like love this process, and I think it's so important that students learn whether or not they want to specialize in it. I just think it's really important that students learn about natural medicines. But I actually just signed a job, like contract.
What?
Yeah,
exclusive.
earlier this
We're dropping the news on here. I like it.
It's new news, yeah. And so that will be starting right after residency.
Can you say like what it is or like what kind of job it is? Okay, that's fine.
Yeah, no, I can tell a little bit. Yeah. Okay. So I'll be working for a new company that is based out of in the LA metro area.
Okay.
And so I will be kind of heading up their entire pharmacy services department. And so it's going to be like a showcase of various cannabis products. But they want to have a focus section on medical cannabis. And so I'll be heading up that entire like facility from like choosing the counters to the inventory to the humans who work there to like all the like the protocols and training and like all of that. So I'm just going to like start it from the ground up, and I'm so excited.
That is awesome. You've been at PharmD for 1 year, right? Not even?
Almost 1 year. Almost-ish.
Okay. So like I was saying earlier, like I'm up until this moment, I was pretty happy with where I've gone. Now I realize that it's time to really step up my game because Swathi, you're killing it. Like that's crazy.
And I mean, I got this job though because of networking on LinkedIn.
That's awesome. You hear that, kids?
Like
that's go network on social media.
I mean, I've said that for so long that like networking is so important via LinkedIn, but I feel like I actually have concrete like evidence now that it worked for me and I found a job that I'm so excited about.
That is awesome. I mean, that to me is the future. Because then now as you get that program started, like I feel like they're going to be coming to you now wanting to come train with you. Just like back in the day, they want to come to a university because they want to do research.
And then we could have an appy program.
Right.
We could have students come. It'd be amazing. Yeah.
My goal eventually with the core console stuff is to grow it enough to where I can actually get like a rental condo, rental house. So I can have like 8 or 9 students from different areas come in, and have like a dorm, like a core console dorm room, like decked out so people can come in from like each month.
They could do like journal clubs every day, and
like just nerd out. I have to be like a special, like you're like, listen, you got to be a nerd to come as rotation because we're gonna be doing a lot of nonsense. But I think
good
that
nonsense,
yeah, for sure. That's awesome. I'm super happy for you.
Thanks.
So what else? Anything else you interesting that you can think of? You want to make sure we talk about? I know I've just took you all over the place. I should have had like some kind of an outline. You know how I get. Real quick, there's a question on Instagram.
Ooh, okay.
Somebody is saying that they're interested in academic pharmacy as a career.
Ooh, cool.
Do you suggest a residency route? Currently working as retail. Thanks. So. Username BPN53. So I'm not trying to not pronounce your name, but I don't know what that is. So to give you my personal thoughts on that, in academia, I would definitely suggest doing the residency route, unless you can find a way to like, if you're not going to do residency, I would get very comfortable with the idea of like the next 3 years or 4 years after you graduate, every second of your free time needs to be spent volunteering in academia.
And learning more and getting certifications and really like building out your CV in that way.
Absolutely.
Doing research and stuff like that.
So I literally from 2015 when I graduated, 2018, I spent all of my free time. I mean, literally all my wife was like thinking I was going crazy. Volunteering and helping with like P1 lab. Yeah. Any teaching, is much different than giving, and I'm still by no means a good teacher, but teaching is so much different than just giving a talk or a journal club. Like running a class, right, is like holy crap, this is not as easy as it looks. It takes a lot. I mean, I've been doing it for 3 years now. I teach. I taught 3-hour lecture today, and I'm just like, I botched this, I messed that, and like it's so much. So the more practice you get, and the more people that know that you have that ability to teach, I think will open up. So if you're not going to do a residency, which I probably would say go that route if you're going to do true academia, but if not, you better get real comfortable with when you graduate, that is just the beginning, and start volunteering.
And I think pharmacists overall are lifelong learners, I want to say. But I do think it's just so important to like continue learning, whether that's even just, getting on the free newsletters and getting them to your email or listening to the podcasts from FDA or like, there's all sorts of options, but just staying up on what's going on, I think is really, really important.
Absolutely. So good question. So how can people get in touch with you if they want to talk to you or reach out to you? So LinkedIn? Yeah,
LinkedIn is great. And then apart from that, you can email me. So my email is Swathi, so SWATHI at Dr. Swathi, so DOCTOR, and my first name is SWATHI.com. So you're welcome to email me or just connect with me on LinkedIn.
That's
I'd
awesome.
love to connect with students and stuff. It would be so nice.
Heck yeah.
And pharmacists too, but yeah.
Yeah, we'll let them do it. And I'll put the email and stuff in the show notes as well. And then if I get questions, and I'll shuttle them towards you.
Please do.
Yeah, for sure. So make sure you go follow Swathi on LinkedIn if you know what's good for you. So yes, Swathi, thank you so much. I know you're busy and getting on the speaking lecture circuit right now. So I thank you for coming on here.
Oh, of course. Thank you for having me.
Super pumped to get to talk to you again. Congrats on everything.
Oh, thank you.
So thank you guys so much for listening. If you have any questions, obviously you can email Swathi or myself. Those will be in the show notes, like I said. If you want to reach out on Instagram, Facebook, any of those things, you can definitely do that. We have the texting platform now, like I've mentioned several times. Area code 415-943-6116. Reach out and you can text me directly on that. I'll get back to you on any of those platforms as quick as I can. We've had quite a few of like incoming messages and things like that, so I promise I'm not trying to ignore you. I'll get back to you as quick as I can. But thank you guys so much for listening and the support. If you do like the podcast, make sure you hit the subscribe button. That helps us out. Even give us a rating. That also helps us out. I haven't mentioned that in a few episodes because I'm trying not to get redundant. But if you can hit a rating and offset those haters that give us those bad ratings, that would be helpful.
All 2 of them.
Yeah. But thank you guys so much. I will see you next time. Later.